The first line of the NHS constitution says that it belongs to the people. So what people think about it and the service they get from it is crucial. A new poll from Ipsos, exclusively for Sky News, shows that they don't think much. And because we ask the same questions internationally, we can compare that to how 16 other countries think about their own healthcare systems. Take our first question. Over the coming years, do you expect the quality of healthcare that you and your family will have access to locally will improve, stay the same, or get worse? In the UK, almost half said they expect the NHS to get worse over the coming years. Only the French and Hungarian publics were more pessimistic. Compare that to Australia, where 29% thought it would get worse, or Japan, right down at the bottom, where it was only 14%. And when we asked people whether they thought their health service was overstretched, 83% of the British public thought it was. That's the highest of any country we asked. Now, you might object that this reflects a particularly British miserablism in our attitudes, and we do tend to be a bit Eeyorish about predictions while still being very positive about the care we're actually getting. But that has changed too. Satisfaction in the NHS has plummeted since the start of the pandemic. As recently as 2018, the British public were more satisfied with their healthcare than people in any of the other countries. But each year the UK has been slipping down that rankings. It's now in 6th place. And much of that feeling is related to waiting lists. During the pandemic, health services around the world postponed elective procedures to free up beds. The difference is that with other countries, they levelled off, like in Sweden, in blue, or even fell in green, like for Ireland. Instead, though, in England, up here in red, the waiting list kept rocketing upwards. It's now more than 80% of what it was compared to the same month in 2019. The NHS has faced pressure of some sort for all of its 75 years. But if you look at the data and the public's perception, the last few years have been particularly acute.